Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alford. Joining us today is Dr. Barton Wax, an orthopedic hand surgeon from Gulf Coast Orthopedics and Terrebonne General Health System. Welcome to the show, Dr. Wax.
Thank you for having me.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Sure. I am an orthopedic surgeon, specialized in hand surgery. I just recently joined Gulf Coast Orthopedics. Been here for about 4 or 5 months now. Loving it and very happy to be here.
Great. We're so glad you're here.
Thank you.
We needed a hand surgeon in this area, so
Happy to help.
So glad you're here. Well, we want to talk more about hand surgery and getting to know the importance of when somebody might need hand surgery. So let's kick it off with just asking about yourself. How did you decide to pursue a career in hand surgery and orthopedics?
Sure. I've always loved orthopedics. I have known I want to do this for a very long time. Hand surgery was a really neat way to be able to mend the two, be able to get people's function returned back to them, get them back to normal life and work, and get them back on their way. I was an athlete growing up, and had an injury at a young age in about 6th grade. Had a very positive experience with the local orthopedic surgeon. Really looked up to him as a member of the community, and both as a surgeon, but as a person, just a pillar of the community in general. And just kept those relationships up. He and I are still friends, actually, to this day. And then I had the privilege of working under a hand surgeon who was a true mentor for me. And basically, he was the reason that I became a hand surgeon. He was a true gentleman and a fantastic surgeon. And so I wanted to be able to be more like that. And hopefully, I'm getting there. I'll be there one day. I went to LSU undergrad in Baton Rouge. I went to LSU Medical School in New Orleans. Did orthopedic residency in New Orleans as well at LSU. Did my hand surgery fellowship in Miami, only because there wasn't one at LSU in New Orleans. Yes. I have a wife and 4 kids, and so we're very busy at work and outside of work.
Oh, are you from the area?
Born in Denham Springs, and I live in New Orleans now, but I love home.
And are you an avid sportsman?
Yes. I like to fish. I like to hunt. I do sailboat racing on the side. A lot of chasing the kids around, watching their sports and their activities, and they're busy and they keep us busy. But it's nice to be outside and work in the yard and do those sorts of things around the house too.
Well, what is the difference between seeing a hand surgeon and just a general orthopedist?
So I did general orthopedic training, and so I'm happy to take care of all bone and joint injuries, musculoskeletal injuries in general. I did extra training in hand surgery, which is just basically from the shoulder down with extra focus on elbow, wrist, and hand.
Okay. So when does hand stiffness or a problem with the hand constitute needing to see a specialist?
Sure. At any point, if you have hand stiffness, hand pain, it's certainly when it's limiting your activities and causing you pain, giving you difficulties with daily activities, it is absolutely worth seeing a hand surgeon.
Okay. What are some of the most common hand problems that you see?
Sure. Carpal tunnel syndrome, trigger fingers, arthritis of the hand, wrist, fingers, and of course fractures, traumas, lacerations, tendon injuries.
And are there any warning signs that people should be aware of?
Certainly. When you start to have numbness, certainly that wakes you up from sleep, for instance, that is certainly a good sign for carpal tunnel syndrome. When you have snapping of the fingers, that's usually very common for trigger fingers. Just any sort of pain when you're having weakness, numbness, things that are certainly abnormal, and it goes without saying, lacerations and other injuries, things that just don't look right, fractures, for instance, by all means, that should be seen by a hand surgeon.
Right. And I know most people put off pain for a long time. They just take it until they can't take it anymore. What do you say to that?
That's fine.
Right.
Everybody has a different pain tolerance, of course. And so when people get to the point where they can't do what they need to do and their pain is certainly limiting their activities, then absolutely that's worth seeing someone.
Yes. And do all hand problems require a surgery, or are there other treatments that you also provide?
Yeah, there are certainly plenty of other treatments besides surgery, whether that be medications like anti-inflammatories or bracing or therapy or injections. There are certainly lots of things short of surgery. Of course, some things need to go straight to surgery, unfortunately, but there are plenty, most things, I would say, most of the common things are able to be treated without surgery, certainly in the early stages.
And how do you decide, like, does somebody need surgery? Do they need an injection? Do they need therapy?
Sure. Usually a very thorough physical exam, often X-rays, being able to, sometimes check their labs and do other things along those lines. In general, people who are diabetic or who have thyroid dysfunction have much higher instances of things like carpal tunnel and trigger fingers, and so they should certainly be keeping an eye on their glucose as well.
What are some new technology that you use to treat some of your patients?
Sure. So I do endoscopic carpal tunnel surgery, which is just through a small scope, a small camera, being able to watch it on the television screen without making a larger incision. Similar treatment for elbow arthritis. A lot of scopes using the wrist arthroscopy and elbow arthroscopy to be able to treat some arthritis type conditions as well.
So, what is one of your favorite procedures to perform?
I would say endoscopic carpal tunnel release surgery is a really fun surgery. Feels almost like you're playing a video game. You're able to watch it on the television screen while you're working down here. And patients really do well. They have a very quick recovery. Often within a couple of days, they're back to their normal activities, even heavy laborers.
How often do you think you see like a carpal tunnel
Oh, gosh.
case? Is it very popular?
Almost every day, yes.
Every
Certainly,
day?
I would say every day for sure. Very common.
Can you kind of go through like what the symptoms of carpal tunnel are and how would it be treated, and then what the recuperation period would be like?
Most people that have carpal tunnel syndrome will have numbness in the thumb, the index, and the middle finger, sometimes part of the ring finger. There's also cubital tunnel syndrome, which is the funny bone nerve, which will give you symptoms to the ring and small finger. Either one of those, they're very similar problems, treated very similarly as well. You can do a brace that you wear while you sleep, anti-inflammatories, both orally and topically. There are cortisone injections we can do right at the area. Occupational therapy, hand therapy isn't always as useful, but certainly can be an option, and then ultimately surgery if necessary.
Yeah. And are there certain jobs or hobbies that make people more prone to this?
Yes, actually, jobs that are more repetitive in nature and jobs that are more vibratory in nature, whether that's dentist or dental hygienist, or patients that use things like jackhammer or any kind of impact wrenches and tools like that.
Right. And a lot of people in this area, work with those types
Absolutely.
of tools for sure. How can people prevent injuries from their hands or to their hands?
Certainly, traumatic injuries can be prevented wearing gloves. There are a lot of things, saw stops. There are a lot of neat inventions out there that can stop injuries. But just general prevention, being cognizant, being aware of what the sharp objects around you, and not putting your hands in places where they probably shouldn't be.
What is an important thing you would like people to know about orthopedics?
I think most people think as a hand surgeon that surgery is the first and foremost option. It is certainly not the first option, almost never the first option. There are oftentimes lots of other treatments short of surgery that we can try and exhaust those before we ever have to go the route of surgery. And in general, I never talk a patient into surgery. They will know when it's time for surgery. If their pain is bad enough and their function is impaired enough, then surgery becomes a better option.
Do you see many sports injuries?
Yes, absolutely. Lots of mostly fractures, dislocations, lacerations, injuries like that. Usually the patients are able to be treated pretty quickly. Oftentimes they can be returned to sport in a pretty quick fashion within a few weeks. Even with surgery, able to brace them and be able to fix them, be able to get them back on the field quicker, and in a much stronger way.
Yeah, you mentioned that you had a sports injury. What sport did you play?
Yes, football and baseball growing up. But yeah, I broke my patella in middle school, and so that was sort of a defining moment for me. And I was a catcher, played baseball as a catcher, so had to change positions. It sort of was life changing, yes, but obviously pointed me in a good direction.
Were you able to get back to doing that, or?
Yes, I was. I ended up changing positions for different reasons, but that actually helped define maybe why my knees are in better shape today than they would have been otherwise.
So do you feel like having that experience as a young child, boy, does that help you to relate to your patients better?
Absolutely. And being a former athlete, it really helps being able to empathize with both the athlete and the coaches, the parents, the athletic trainers, all the folks that are around the athlete, not just the athlete. And I'm the product of two school teachers and coaches and principals, and so my whole family's in the education system, and so I really have a lot of respect for coaches and teachers and the people who kind of form our young people, and so they certainly play a really strong role when a young athlete gets hurt.
Right. And athletics is such a big part of growing up, and especially in this area.
Yes.
So if a child plays multiple sports, what kind of advice would you give the parents?
I would say that's great to play multiple sports. There's a lot of new information, a lot of studies coming out that show young athletes who super specialize in one sport tend to have a much, much higher injury rate, and oftentimes they have a much lower chance of making it to the next level in their particular sport if they specialize, as compared to individuals and athletes who play multiple sports, because they can give certain muscle groups a rest and they don't overuse. Young pitchers is the classic example, and they always seem to have elbow and arm injuries. And so all the new studies are showing that if those young athletes, multiple sports can be really helpful to give them rest, and so they don't overuse those certain muscles and actually can tend to play longer and at a higher level at the end of their career.
Right. Are there any preventative measures that they can take?
Certainly. There are really strong data out there about pitch counts, young athletes, especially pitchers, and there are age-based criteria as far as the number of pitches per day, per weekend, per week, per month, and certain types of pitches. There's very good data out there that shows that living within those pitch counts and being very faithful with those can really increase the longevity of their career.
Okay.
And decrease injuries.
That's what we're trying to do, is
That's
prevent
right.
injuries.
That's right.
All right. Well, how can someone schedule an appointment with you?
So they're welcome to come see us at Gulf Coast Orthopedics. The phone number
Yeah, it's up on the
will be right
screen.
here. I'm in clinic almost every day, and we're happy to help.
All right. Well, thank you so much for this important information and for welcoming you to the community.
Thank you.
We are so glad to have you.
Happy to be here. Thank you so much.
For more information on hand surgery and orthopedics at Terrebonne General Health System, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks for joining us.